So what are some of the symptoms? So, do you have adrenal fatigue? Again, because it's this nexus diagnosis. It's not really technically a diagnosis. Nobody in medicine will ever tell you that adrenal fatigue is a real thing. But how does it start? What are the kind of some of the things that really begin? And so this is kind of a list of symptoms that we can see that many people will develop. So again, not everybody has all of these symptoms. Not everybody will develop every single one of these symptoms, but these are things you can look at. Now, these things over here are more common. So one of them is chronic fatigue. That, in my experience, is probably the most common, is just chronic fatigue. What a person will oftentimes say is, 5 years ago, 6 years ago, I could work all night, I could play all day, I could stay up, I could drink, I could exercise, and I could cruise, and I wouldn't have any problems. Now, the smallest amount of stress completely wrecks me for 2 or 3 days, right? That's where that chronic fatigue starts to set in. What's happening here is a person is becoming stress maladapted, meaning their adrenal glands are starting to get tired because they've been overworked for too long. And this will also be accompanied with muscle weakness. And one of the reasons why is that, initially in some of the earlier stages of adrenal fatigue, so think of adrenal fatigue as not as, your adrenal glands are tired or they're not tired. Think of it, there are stages of what the adrenal glands go through. The initial stage of adrenal reaction is what we call the acute stress stage. Let's make some more room here. So you've got acute stress, which generally, if it's truly acute, meaning it lasts for a few days at most, it then goes your body. So acute stress, your body responds to acute stress by increasing cortisol and adrenaline. And as long as the stress goes away, right? When the stress goes away, this will drop and everything will come back to normal, okay? This is where the problem sets in, is when there's chronic stress. Stress lasting for weeks to months on end, and there's no reprieve, right? And so initially, again, with acute stress, these things go up. Your cortisol goes up, your adrenaline goes up. Those are things that initially will elevate. And in an attempt, your body, what it's trying to do is it's trying to make hormones that help you adapt and deal with stress. But if that stress stays there for too long, you'll actually see, so going back to this diagram, right, where cortisol kind of follows that curve, right? What you'll see with acute stress is instead of this curve, you might see a minor spike. But with chronic stress, what you're going to see a lot of times is that morning time cortisol is even higher. It's even higher. Sometimes I see it in people off the chart. And then we might get where it drops, and then we might get a spike in the course of the day. So you get instead of like this smooth downward trending curve, you might see it drop and then spike back up and then kind of drop again. Like that's a pattern. So there are different patterns with chronic stress, and so it's because your body is trying to adapt to the stress. So the longer it's there, your cortisol levels will start to yo-yo and they'll start to seesaw. And as that happens over time, initially that cortisol, that adrenaline are high, but the longer this goes on, beyond the with the chronic stress, the longer this goes on, these hormones will then they will really start to plunge. Right? So instead of being high, they'll really start to plunge, and then you won't have adequate cortisol. And when you hit that point where your cortisol's on the floor, maybe your cortisol, instead of it being way up here and curved like that, it's just kind of flatlined, right? At the different times of the day, it doesn't really change. There may be a 5 to 6 point differential in these as opposed to a 10-point differential. But this is more of a flat line. And this is when you're in bed all day. This is when you're tired all the time. This is when you wake up after sleeping for 8 or 9 or even 10 hours and you still wake up tired and you have a hard time peeling yourself out of bed. That's chronic stress, right? And this can take depending on the person, there are a lot of variables here because it depends on how well a person eats, whether they exercise, get sunshine, whether they go to bed on time, whether they're dealing with a lot of job stress, whether they're dealing with a lot of relationship stress. So like a lot of it is dependent on multiple factors, which can make it challenging and hard. But ultimately what happens, that person loses their ability to adapt to stress because they are flatlined. This is, again, that stress maladaptation is because they flatline out their cortisol. They can't get a boost out of it, and so they can't function. And this is, a lot of times where people, again, chronically, they're in bed. They don't want to get out of bed. They have chronic fatigue syndrome, CFS. They have muscle weakness. Their muscles are deteriorating. They're in bed. They're tired all the time. They're not exercising at all because they can't tolerate it. So exercise intolerance is a very common symptom of adrenal fatigue. And then we get, we can get abdominal pain. And one of the reasons why they get the abdominal pain is because chronic stress hormone production and chronic stress shuts down the gut. It shuts down the motility. It shuts down how well you digest. Chronic stress reduces gastric acid secretion, reduces enzymatic production, so enzyme production by your pancreas and by your GI tract, so you don't digest your food as well. So now your food sits inside of you and it kind of rots inside of you, and that can lead to a lot of abdominal symptoms and pain. We also get weight loss. Initially, right? So in an earlier chronic stage, so again, this is where there's nuance to this. And so before you're completely maladapted to stress, there's a stage where it's predominantly, I'm tired all the time, but it's not weight loss. It's actually weight gain. Because initially, remember what I showed you a minute ago with that cortisol curve. Initially, let's move this out of the way again. You might be in a state of earlier chronic stress. Again, there are levels of chronic stress where your cortisol is way up here and it's staying higher. It's dropping in a normal type of pattern, but overall you're producing more of it to cope and adapt to the stress. And remember that too much cortisol, what does it cause? It causes muscle loss. It causes bone loss. It can elevate your blood sugar, right? Which leads to weight gain. So this is part of kind of an earlier, think of this as an earlier stage of the beginnings of adrenal fatigue, but multiply that over months to potentially out to a year, and that weight gain starts to deteriorate because you're losing muscle mass, you're losing bone mass, your appetite's not there because you just don't want to eat. And that's where this really starts to kick in. So a lot of times, again, earlier stages, we'll see weight gain, and then subsequently weight loss will come after that. And then these are some of the additional possible symptoms that we'll see sometimes people will manifest with: nausea, vomiting, diarrhea. So again, what are these? These are all GI symptoms. Your body's saying don't eat. We don't want the food because we're not doing anything with it because the stress hormones are shutting down the digestive tract. And so your body's trying to reject food. Lightheaded when standing up because, again, chronic stress can affect your blood pressure through mineralocorticoids and hormones like aldosterone. Irritability and depression, joint pain, severe salt cravings. I hear this a lot. People crave salt. This is especially true in the later stages of adrenal fatigue. And then we get low blood sugar. Initially, it's high blood sugar, but over time, the blood sugar levels become hypoglycemic because people can't regulate how they're processing carbohydrates, and so they can't make energy from the food they're eating. Irregular menstrual cycles or no menstrual cycles, the chronic stress will shut down sex steroid production, and no interest in sex. So libido on the floor, and severe enough, you get darkening in the folds of the skin. So like in the elbows, the backs of the knees, the back of the neck, that skin will start to turn very, very dark. And that's not a good thing. That's a later stage. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.